All right, welcome everyone to another week of Blueprint for Peak Performance. Ask Me Anything. I'm Brandi Smith, the founder of Perfect 10 Physical Therapy and Performance Training and Perfect 10 PT Academy, online courses for coaches, parents, and athletes. Welcome everyone. This week we have opened up to Q&A. So this week it's free Q&A with me. You get to ask any question you have about your athletes, about your team, about coaching, about being a parent to an athlete, any of those things. Shaylin, you want to go ahead and accept panelists. It does not mean that you have to talk or have your video on or any of those things. But what it does do is allow us to chat in the chat better, all of those things. Awesome. Welcome, welcome, welcome. All right, you guys. So let's just open it up. It is, let's see, 2 weeks into summer, and some of your gyms may have already taken a summer, like a week off kind of break. Some of you guys may not, have just kind of continued on, might have already started some summer camps. Whatever you got going whoops, whatever you got going on, I want to hear about it and find out how I can help you. Yeah, come on in, Patricia. So go ahead and unmute.
Yeah, sorry, it took me a second to get off mute. So I have a question.
Mhm.
It's pretty general, but I'm hoping you can answer it. And as a mom to a gymnast, I've been in these Facebook mom parent groups,
Mhm.
and at least once a day, somebody jumps into one of these groups and says, "Oh my gosh, picked up my kid from the gym and her knee is swollen," or she says this hurts, or
Mhm.
what do you guys think? And my first thought is, wouldn't come to Facebook for medical advice, but I do wonder because I have been guilty of this as well in the past as a runner, never a gymnast. Sometimes when my daughter says something's sore, something's hurt, that I'm like, oh, rest it, ice it, heat pack, elevate it, let's wrap it, let's tape it. And I now question because there have been times when she's come to you and you said, oh, well, like her hip's tight, or this is off, or this is off, and you find something a lot more specific that I think, and those of you who are gymnasts will know that probably lots of gymnasts train, keep going. I've heard of gymnasts saying, yeah, I had a broken toe, I taped it and competed anyway.
Mhm.
At what point, as a parent, do I say, this doesn't look right, this doesn't sound right, and I
Mhm.
should probably get medical care as opposed to let's rest it, let's tape it, let's ice it?
I absolutely love this question. And I actually have a handout for this. So those of you that are here live, you're going to get a handout. So let me find my parent. I do parent workshops at gyms. And I also have created parts of handouts. So those of you that are in here that have a gym, you're welcome to use this handout. It has my information on it and stuff. But you're welcome to use this handout as part of your manual, your team manual, your pre-team manual. I've done parenting a gymnast 101 where we come in and it's like right when the kids have entered their first pre-team, and it's kind of this orientation meeting, and I've done like an orientation type teaching to parents and stuff. So I've done this in a couple different ways. I have two different handouts, so let me see which one. um, they both have a little bit different information on it, so I'll probably just drop both of them in as long as I can. Let me see, where did I put I feel like I updated these. Let me make sure this is the updated version too. Yeah, that's last opened. No, I want it modified. That one's not modified. One second, guys. Yeah, okay, this one's modified. Good. But that is pages. Is this that? No, that's the presentation. Okay, let me convert this to a PDF really quick. Um, So there's a lot of great information on this handout. Let me find that other one. There's another handout. So if I do this one and I go to export as a PDF, I can put it in for you guys. Um, Save, desktop, export. Okay, so I'll drop in this handout that has how do I care for a growing gymnast? Like that's like the entire topic of it. Let me find this other one though, and it's a pain handout. This is the PDF. Oh, okay, perfect. This was the updated PDF. Okay, great. Okay, so let me see if I can, hopefully, let me see if I can drop this into the chat. I think I can drop PDFs into the chat. Um, hmm, let's see. Okay, Dropbox, my computer. Yep. It's not letting me connect to my computer. That's funny. Okay, so let me drop it really quick into Drive because I can give it to you guys in a Drive file easily. Okay, so this is a great question. Hey, Carla, come on in, promote panelists. So the question that Patricia has is how do I know when pain is pain and it's a thing that needs to be looked at? And how do I know when, let's see, my Drive, when it's just something that's just going to get better on its own? Let me get this to you guys on a Drive. I'm going to try to talk at the same time, but that's not working. So sorry, guys. But I know that this handout is going to be really helpful for you guys. I actually think I taught this in my Invincible Athlete recently because this came up with like last month, I think, and we were talking about
And
injuries.
while you're working on that, I'm
Mhm.
just if I
Yeah,
can
keep
add
talking.
on a little bit to that question.
Yeah.
Something else that I've heard is when gymnasts have said, during practice, something hurts,
Mhm.
and being told by a coach, walk it off, shake it off, don't
Yeah.
cry, get back up there. Again, how do we, as parents, support our kid? Because we're not in practice to say, hey, this is the point where you say, I'm not faking it, or I'm not just tired. This is really pain, and I shouldn't go on.
Yeah. And so one is the reason I do the education I do is to try to help educate coaches, right? To help them kind of learn to allow paste. Okay, here's one of them. So you guys can open that up while I'm talking. And then let me get the other one, parent handout for pain. Okay, so there's two handouts here. One is how do I care for a growing athlete? And the other one is a parent handout. There's a little bit of duplicated information, but there's also very different information on there too. So let me put this other one in, paste. There we go. Okay, so it's in the chat. You've got access to both. And what I might do for those that aren't able to access this and are live, I will open, yeah, okay, so I'll open this in and share my screen. Okay,
And you shared the same link twice.
really?
Yeah, those two docs are the same.
Which doc did it take you to?
How do I care for my growing athlete?
Okay, it didn't copy okay, hold on. It didn't copy the parent handout for pain. Okay, one second. Let me get back to Drive. Copy. This is how do I care for a growing athlete? Close. And then parent handout. And make a copy note. Share. Get link. Okay. It's coming. It's coming. There it goes. Okay. Check this one for me, Patricia, because this should be pain. Parent handout on pain. Check that. Okay. All right, so let me go
That
to,
one's different. That worked.
yeah, okay, great. Okay, all right, thank you. So let's talk about this because I really think this is a big topic. As a parent myself, I also sometimes even as a medical provider struggle because with my own daughter because sometimes she doesn't tell me everything. Like as in she doesn't like she's sometimes can be a horrible historian about what happened. And this goes for all kids though, right? So one thing is that I want to talk to, so this is what I kind of want to just do a quick guide to kind of show you. So we talk about here in the how do I care for a growing athlete, what is normal pain in gymnastics and what is not, right? And so actually, let me go to that one first, the pain one, because I feel like um, it's a little bit better on this exact question. And then we can kind of go a little further into some of the other things. So, what is pain? So first of all, normal muscle soreness, right? So one thing that I'm gonna kind of stop screen share for a second is that normal muscle soreness, and let me pin myself. So normal muscle soreness, they're going to point to like muscle bellies. They're gonna be like, I'm sore here, I'm sore here. They're going to, point to their quads and it's sore here. I'm really here. And these are going to be like big muscle belly things, and they're going to kind of correlate to like, we did a lot of legs yesterday, or we did a lot of arms today, or, you know, and I try to teach, kids like, have you ever helped your parents carry in the groceries? And by the time you carry it all the way from the grocery store to the car, and then, or all the way, you have to go far away, your arms are kind of burning, right? Like that's muscle soreness. They're active. That's good, right? And we know that when you're sore in your muscles, that's when your muscles are repairing. So you work out hard, you have a recovery period, 24 hours to sometimes 48 hours, but 24-hour recovery period. And in that recovery period, you're sore. And that's when your muscles are actually getting bigger, stronger, healthier, etc. Because there is normal like micro tearing. If I have a bunch of muscle fibers, there's normal micro tearing that happens in some of the fibers. And then the body lays down and it gets stronger and builds hypertrophy, more muscle fibers, right? So that's like normal. But if you have an athlete who's like, it hurts right here, when they start using one finger, right? Or they might even go right here, they start drawing things. Um, and if you're the really quick, easy ones to go to is they're pointing at a bone, or they're pointing to like a growth plate. So you have like a growth plate here. You have another growth plate here. Easiest one is on your heel. You have a growth plate. Everybody knows about that one. You have a growth plate, right here on the bumpy part. Let me see if I can show you. You have this bump that's right here. There's a growth plate here. It's very common. Another one on the right here on the kneecap and right on the heel. And they'll pinch the heel, or and they'll say it hurts. So if they are really pinpoint about where their pain is, that is a sign that something's going on. If they are really consistent when it hurts, they're like, it hurts every time I do a bridge. Every time I put weight through my wrist, it hurts. Every handstand, right? So when they can be really specific about what skill is bothering them, what activity, so they might have a list of skills, but when you go back and look at it, it's like back walkovers hurt, back handsprings hurts, a back walker, back handspring, a front walker hurts. It hurts when I hit the board and arch into that heel drive on my front handspring, right? It's like those are all arching skills. It hurts when I do my tap swing. So some of those things, so you start to hear a theme in their complaints. When does it hurt? Where does it hurt? And you have to pull this information out, especially between 12 and 16. It's like pulling teeth. You have to ask. The little guys will tell you. The older guys who are in college who've had a good experience with their body and with providers, they'll tell you. If they've had a bad experience, they've been told to ignore their body, they've been told there's nothing wrong with them, they've been told that they're crazy. Like by the time they're all done, they think they're crazy. They say nothing and they let things go on for a really, really long time. So I love when I get little guys in early with their first pain experience, because then I can explain to them what pain is. Pain is information. So I like to teach coaches and athletes and parents that pain is information. And now we're on a little bit of a quest as to what information is it telling us. Pain can tell us a lot of things. Pain can be related to fear, pain can be related to stress, pain can be related to a physical something going on. And so fear and stress, well, fear, it'll correlate with like things that they're afraid of, and they may or may not be realizing that they're kind of anxious about it. So you start asking about anxiousness, that kind of thing. Sometimes, so when someone has an acute injury and it happens, the very first thing I say to them is take a deep breath. That was kind of scary. Did that seem scary? Was it scary for you? Because almost anytime you're not expecting to have an incident where you get injured, right? So it's scary. And so by acknowledging that it was scary and fear, I've already started to take away the fear aspect of what's causing the pain. And so then once we get through that and we calm down, then I say, okay, can you start to do a body assessment for me? Can you scan your body from your head to your toes to your fingertips? Is anything hurting? Can you wiggle things? Can you wiggle your fingers? Can you wiggle your toes? Can you move your ankle? And I start like, let's say it's the knee. Like you just said, I start out like, oh, okay. And they start going, oh yeah, I can wiggle my fingers. Yeah, that's good. Oh, my toes. Yeah, I can do that. So what's doing is the brain is calming because they can do these things. So I ask them to do things that I know they can do away from the injury site first, so that the brain starts to calm down and regulate, right? So I'm starting to take away the brain of stress and fear as part of the pain, and then gradually getting down to, is there really a physical thing that happened, right? And so again, when we're getting to the physical aspect, pain, most injuries. So if there's an acute injury, right? I landed weird, I did this thing. Inevitably, there's something going on that needs to be kind of addressed. So, like even a short landing, if you mobilize that ankle really quick, they won't have any issues. But if that ankle gets stuck and jammed, just like, two puzzle pieces meant to be put together and moving nice and smoothly, if I jam it up, I'm not as happy. And I'm probably going to have some pain and I'm going to walk around it. I'm going to move around it because I got to get 10 degrees to walk, 15 to 20 degrees to run. And now I kind of have other issues that I may or may not realize are happening. So in several of my programs that I teach coaches how to mobilize basic joints, saying, hey, they land short, have them do this little exercise afterwards. Even if they don't have pain, do it, loosen up the joints, and then they can bounce around and they go, oh, yeah, it feels okay. Yeah, no pain. Okay, everything's great. Okay, then let them do like a lower progression of that skill to fill it out. Part of this is mental, part of it's physical. So we're doing both. And then let them do the skill if they felt good on that lower level basic, right? Um, One is you're building some confidence back, so because something happened and they felt it, right? And then two, you're seeing like, are they capable of like doing these things? I can't tell you how many older athletes who've been told to kind of ignore their body and they said just shake it off, everything's fine. That they will actually have a hard landing and they will get up and they will do that hard skill again with pain. And I'm like, and you kept going? Why? And the problem is that they kind of haven't been heard. And I really like to promote with coaches that we really need to listen to our athletes because it's more detrimental than not um, to how do I say this? Not downplay, but like dismiss their pain, dismiss their emotion. So dismissing pain is just like dismissing someone's emotions. It's like I showed up at the table, I was vulnerable with you, and I said, I feel sad, I feel angry. Or I showed up at the table and I gave you my opinion, and you said, yeah, whatever. Like, so that dismisses them and it creates a culture of codependence and a cycle that's not healthy by all means and without putting like a label on it. So that being said, I would say very few athletes, I would say less than 1% that I work with, are making up pain. And if they make up pain, like it hurts for whatever, again, pain is information. Why? Are they lacking motivation to be at gymnastics because gymnastics is no longer their love and passion? Are they having bullying situations in their gym? Like, is there a parenting thing happening? Is something happening in the family dynamic structure? Is there something happening in the gym dynamic structure? I've seen bullying. I've seen athletes. Now my back hurts. I'm not going to do beam today. And in reality, they don't want to be in the beam group because those girls are being horrible to them and their mental and emotional health is horrible. So they'll use their physical pain to get away from the situation. And they actually might be experiencing pain. And that's the other thing. The brain does really interesting things. Now, that is not a huge percentage, right? But again, when that happens, I need to question what's going on for that athlete. Like, hey, what's going on? Like, kind of just pull them off the side. What are you feeling? And I think that this conversation stuff starts really early. So I love, like I said, going back to those first time athletes who start to complain about pain or have aching, this and that. Teach them what's normal muscle soreness. And then back to like, okay, is this pain that we need to go get like treated or looked at? So the first question is, can they pinpoint it, right? Is it not a muscle belly? Is it on like a tendon where a muscle attaches to something, right? Is it on a bone itself? Is it on a growth plate? Are they specifically saying it hurts right here, right? When they're starting to sandwich or draw areas, and they might say it hurts here and then it moves. That might be a nerve situation. So it's like, but if they can pinpoint it and they say, yeah, it wasn't just this one landing, because sometimes we have an off landing and pain was information to tell me, hey, I don't like landing sideways like that. Please don't do that again, right? That's fine. That's not something that needs to be seen. But if it's like, yeah, every single time I ran, or as I run more and more after that one landing, now all of a sudden, every time I run, I'm feeling it. Every time I'm punching, I'm feeling it. 70% of the time. So there's some tricky diagnoses that sometimes come and go. And those can be really a little tough as a parent because it's like, I thought you were better yesterday and now you're worse and then you're better tomorrow. And so my rule of thumb is that if an athlete has something that is kind of consistently happening, if it's progressing in the same workout getting worse or progressing over a period of 3 days, get it checked out, right? So it's progressively getting like they have progressively less range of motion. You see them wincing more. They progressively are telling you it hurts worse. They're really clear where it's hurting. And maybe they're not super clear. They might even say, I can't really pinpoint it. It's deep inside. That is also another sign of a specific pain because that is still specific. Even though they say, I can't really pinpoint on the body where it is, they're saying it's deep and it's kind of somewhere in there. That's still specific versus like, I don't know, my whole abs are hurting. Well, that's like a muscle thing. That's like muscle sore, right? So when they can get pinpoint and specific with what's going on, when they can tell you specific skills that are bothering them, they may give you a list of skills and you put together in your head, oh, those are all impact skills. Those are all hanging skills where they're like pulling, something's getting pulled far away. Those are all arching skills, right? Those are common ones, right? So then they're being specific and it's like, okay, something's going on because if it's just random, it's like, oh, I had this one thing this one time and then everything else was great. And then it, maybe on Friday I had another weird landing and it happened again, but it didn't happen any other time from there. There might be some joint stuff like, that could be like ironed out, but that's not a thing that's like, go to the doctor, right? Um, what other situation? Let me see if I can square a little bit more if I missed anything in that. Um, yeah, and then also this idea, ooh, sorry. This idea that we have delayed onset muscle soreness. So it is common. Not common, it's not something that should be aimed for because delayed onset muscle soreness is more than enough tissue tearing where things heal and get stronger. Delayed onset muscle soreness is you've taken things a little too far. It can happen because we're finding our like what I call our fences. We're finding what our body is capable of. And if you have, especially an athlete, I was in a study once where they asked me to help give people DOMs, and they hired me at this so it's a physics subtle energy physics lab in California, and I came and I did all these things, and I found that most people won't work hard enough to get delayed onset muscle soreness. So if you have an athlete who's just really a hard worker, or they're really want to people please, like they really want to please their coach, their parents, like, or they're just really driven, they could get themselves to delayed onset muscle soreness. But most people in general don't push themselves that far. But in the athlete world, I would say it's a higher percentage of people that will. And so what that looks like is muscle soreness that shows up 48 hours after workout. They might be a little sore the 24-hour, but the second day, whew, they're getting really sore. And then that soreness gets worse through the next 72 hours. And so that that can take a little bit of period to get down. And the problem with the DOMs is that most people will say just rest, don't move. And that is not the answer. The answer is actually to do whatever it is they did at a lighter capacity. So like gentle movement. So if they did it running, then they'd want to go get on a bike or an elliptical and kind of just move it out every day. 20 minutes, 10 minutes, whatever. If it's in gymnastics that they did it, whatever conditioning they did, do lighter arms, do lighter legs. Don't push them to the point of, hard work. Maybe they even have to be supported on their chin ups. So their feet are on a block and they're just kind of moving. What they're doing is they're pumping out the toxins from the delayed onset muscle soreness. And that blood flow and oxygen nutrients coming in through the movement will actually help the process heal. So this is where rest is like not a good idea. So we talked about pain as information. There are lots of different ways pain can show up. So sharp, shooting, stabbing, dull, aching, throbbing, zinging, or a combination of all the above. It can move anywhere in the body and it can be related to one issue. So for instance, even if I have pain kind of lower down the chain, it could be coming from something much higher. And that's where a medical provider is really helpful, right? And pain also can be caused by an actual mechanism, right? Like they rolled their ankle or they had an actual injury. And then many times, because we actually know that more than 60% of injuries that are seen by pediatricians and medical providers across the US, more than 60% of them are what they call overuse injuries, which means that there was no mechanism of injury. It just gradually came on. And the athlete can't really pinpoint what it was they did. They don't really know, and they don't always know when and why it started. So in that case, this is where that whole like, where are they pointing? How specific are they? And is it consistent, right? So my rule of thumb is that if pain is progressing that day or within the next 2 or 3 days, it progressing being that their range is worse, their balance is worse, they're limping worse, they're wincing worse, they're reporting that the pain amount is getting worse, that is definitely an advocate for like, hey, go get some help. If it's staying consistent at that point, that is also an advocate. Like it's like every single time that they do X, every single time they get in this position or an impact, those are definitely signs to go to the doctor. And then the other aspect is that if it comes and goes, if it's coming more than it's going, that's another sign. So say like it's coming and going over a week period, but you're finding that like it seems to be coming more often over the last few days, then it's progressively becoming more clear that there's something going on. So that's when I would definitely take them in. So we talk about that here, growth plates, consistent, that kind of thing. I also talk about how it can be inconsistent. So another thing that can happen is sometimes pain can be painful after a workout or after doing things. And then it's better and they return and then it comes back again and it does the same thing. So you're looking at pain behavior. So if behavior is consistently happening, even though it's not happening during the activity, but it's happening after, that is a sign that actually could be a tendon issue or some other things happening. So you want to get that looked at. So if it's consistently having the same behaviors of pain, um, I give it usually like 3 to 5 days. And it's like, if that point we're consistently showing a behavior, then there's something definitely that needs to go on. If I know they've had like some landings, as a physical therapist, I recommend that you get seen as for performance checkups at that point because there are joint dysfunctions that happen from short landings or a weird wonky something. And just keeping your body tuned up, just like you would a race car or even my regular car, I don't drive a race car, right? I drive like a Chevy Traverse. Like I have to go take it in today for maintenance. Well, because I want to take care of it and I don't want it to break down on me when I really need it. So it's the same thing with our mind and our body. We need to kind of prioritize maintenance. And unfortunately, in the Western world of medicine, insurance doesn't cover maintenance, right? And so the idea of maintenance for our mental health and maintenance for our physical body is kind of foreign to a lot of parents who like only went to the doctor when they're running a fever, only went to the doctor when they have a virus or or they don't even know. So a lot of us don't take them to the doctor anymore because of a virus, but like only when there was some kind of big thing happening, that's when we took them to the doctor. And then we do one annual well check a year. That's not really how an athlete's body is going to work. You have to recognize, like, my daughter's grown 4 inches in a year. That body's changing. And so if that body's changing, guess what? So are all the forces and all of the center of mass and her balance and how things are working together is changing. And so, a few short landings, a few whatever here or there, it's going to contribute to things being a little wonky. And so it's nice to have a maintenance program. So that's actually what I really recommend is getting a good connection with someone who's really good at movement, like a physical therapist, and then also a nutritionist. That's a good one because their nutritional needs are changing when they're growing. I am having to shove so much food down her body, more than she really prefers because she's used to having small portions. I'm like, you're growing so much and your hormones are changing. You're 11, right? So there's a huge growth period where it's like you have to fuel them more. So kind of having a check-in or at least getting some information, like checking in on nutrition. And then mental health, same thing. Like it's like there needs to be kind of this concept, and I wish the world would get on board with it. I think some parents are. I know that the parents that I've worked with have seen, and that's also in this handout, that when they do maintenance stuff, they spend way less money on healthcare. They spend way less time on healthcare. They spend way less, like everything, because they can just get on a regular schedule and they find things when they come in that they didn't realize were going on. Like, oh, he's grown so much. Now his ankle range of motion went from 20 to 10. He's not having any pain yet, but let's fix that range of motion so that he's back to his full speed. And oh, we fixed that. Now his power is good. Now his skills are going a little bit better. And by the way, hadn't had any injuries. So I've had multiple athletes that had multiple injuries within like a year or two period. And then they decided, I'm like, I've been talking about the performance tune-ups and stuff. And they decided, oh, you know what? Why don't we get on that? And like several of my athletes, Jeremiah is one of them. He did a testimonial, but it's like, he's like, I actually haven't since I had that little slew in like, I think it was like seventh grade. After he did that, he did tune-ups, and sometimes it was 6 to 8 weeks, sometimes it was 12 to 14 weeks, but he kept coming in and didn't have another injury all the way through his entire high school. And now he's into his second year of college. So it's like, that's kept him really healthy. And his parents were like, yeah, why didn't we do that before? Because we spent way less money and time on, in medical care, et cetera. I talk about inconsistent. Yeah. So here I talk about if the cycle, so if it's kind of coming and going, if the cycle goes on for a week, so I said like 5 days because it's about practiced week time. So if the cycle goes on for about a week, then they need to be seen. The brain is giving pain for a reason, and someone needs to kind of assess why. Now, here's another question that people regularly talk to me about is it too soon to be seen for pain? I have a lot of people who are like, oh, it hurts. I'm going to wait till my pain gets better, and then I'm going to come in and get seen for physical therapy. And that's actually not a good idea because the sooner the better. Like the longer you've had pain, the more time you have to compensate around the pain. And the body's smart, it will. And so you limp, you use different muscles, you create muscle imbalances, all of those things. And it becomes more to deal with. You end up spending more time, more money, more time out of the gym, et cetera, because you've developed a bunch of like patterns around your pain. So I say the sooner you seek care and restore all the joints and movement back to normal, the faster the recovery, less time in the gym and life that's lost and less money spent. I like to see injuries within the first 24 hours. That is like, I love to see injuries within the first 24 hours. Ankle sprains, they'll come in. If it's a basic ankle sprain that didn't really involve the ligaments, believe it or not, there's a bunch of ankle sprains that are mostly joint related. And if they come in, they'll come in. I've had people come in on crutches. It's on my Instagram. There's one of them. And someone in one of the Facebook created a little bit of a ruckus or whatever in one of the Facebook groups because they were like, not possible. No way. You didn't do anything. Like, and I was like, no, really. But they literally crutched in, putting just a little bit of toe touch weight bearing with a lot of pain, came in. I totally manipulated a bunch of joints. I got things moving better. We pumped out the swelling. And that kid walked out carrying her crutches. And she actually did some jumping before she left, just little basic jumping to see how it felt, and did fine. So that happens often. I love seeing ankle sprains early because many times that is, the answer. Now, if there's a ligament issue in there, you start to know your time frame for healing, and it's going to be a little longer. But they'll still walk out either without the crutches or a little bit of weight bearing through the crutches. So rest is not the answer. Motion is lotion. This is almost always the case. Like rest is not the answer, almost always, because complete rest is only appropriate for fractures and post-surgery. Or if like the immune system is super compromised and you're down because you're sick, exercising and moving can make the immune system have to work harder. I'm going to stop screen sharing for a second, and Shaylin, come on in, unmute.
Okay, so I have questions. Lydia was just diagnosed with, I might be mispronouncing it, Sever's disease.
Severs,
Severs, excuse me.
Yeah.
And so, the orthopedic urgent care we went to said Motrin for around the clock for a week, ice it 3 times a day. She has a heel cap, and then we got one of those kind of like a sock without the toe, but it's got a little bit of a gel in it, the heel, for when she goes to gymnastics. And he gave us just one stretching exercise to do, which are really calf raises on the stairs. What are we looking at as far as, I know this is a pretty common injury, or not, it's not really an injury, but a condition, I don't guess you would say.
Injury. It's an injury.
Is it injury? Okay. With gymnasts and like as far as recovery time.
Okay, so well, a couple things. So first of all, most commonly behind all injuries, and I will say that it's okay, let me say most injuries, like 95% or more. Um, it's not what they're doing, it's how they're doing it. And so Severs is one of those issues where the growth plate gets irritated around the heel, right? And it's not a disease, it's not a growing problem. It happens in growing athletes. So there's a lot of misconception about Severs and Osgood's and even jumper's knee, which is called Sindens-Larsen's Johansson's disease, SLJ, or jumper's knee more commonly. Those are all growth plate issues. They're inflammation of the growth plate where the tendons insert onto different growth plates, right? And so the growth plate is our bones have cartilage on each end. And when we're young, that cartilage grows. And as it grows, it'll turn to bone. And eventually that fuses together with the bone. And so the importance to that little cush section where there's a cartilage there is that that's what allows your athlete to grow, right? So that's how the bones get longer. It's a process of growing. When you are young, the growth plate is your weakest link, right? So when you're older, your bone and your tendons are your weakest link, which is the reason why you see so many Achilles ruptures in 17 to 25-year-old gymnasts, right? And also the reason why there's ACL tears in college more than there is elsewhere. This is because the growth plate tends to take up forces first because it's so spongy. It's like the weakest link on your growing athlete, right? As the athletes grow, their bones grow faster than their muscles and tendons can keep up. Okay, which is why as our athletes go through these growth periods, you'll see them have decreased flexibility and balance also gets affected because their center of mass at every single one of those joints and then their overall global center of mass shifts quickly during these phases. And it takes a little bit of time for them to find center again in their brain and their body to reconnect all these new moving parts. When that happens, more than not, muscle imbalances commonly occur. Most commonly in a growing athlete, basically the bones will grow faster than the muscles can keep up, like I said. And most commonly, their gluteus medius and their gluteus max and their deep external rotators kind of shut off. The hip flexors like to be the bubba and do all the work. They're the workhorse. And when that happens, and also sometimes their medial hamstring will like to do a lot of work. When that happens, when they go to squat, they will squat like this, right? Coming in. And it may look in various differences. Sometimes it looks like this, where the hip rotates, but the knee is still doing the same problem, right? And maybe so you can see me, I'm white as white can be, that'll be more easier for you to see. But when I'm squatting, if I'm squatting here, still there's a torquing motion happening at my knee. If my hips stay and my knee goes in, there's a torquing motion at my knee. Now, that's Osgood's. It could show up at the Osgood's, but it also can show at Severs because that same pattern, watch my foot. Let's get you right there. So that same pattern where the knee is going in, look at the arch of my foot, right? And when I'm here doing like this, also the arch of my foot is collapsing. So if you look at the heel, when someone's doing this, the knee is going in, my heel. Do you see how? So my body likes to be stacked in general. And the tendons, like when you squat, you land or you jump. The tendons really like to be in this nice line of pull. But if everything has kind of got a little imbalanced because I've grown, then this may happen. And when it does, you can see that the tendon is pulling unevenly onto my heel right here, where I have a growth plate. And that is the most common cause of Severs, is how they're squatting. And it goes along with an imbalance in the glute med, glute max, deep hip external rotators, overactive hip flexors, overactive, sometimes both hamstrings, sometimes just medial hamstring. So it's an imbalance of muscles, right, due to a growth spurt that has happened. The growth spurt initiated compensatory movement patterns because the bone grow faster than the muscle keep up. Do you follow, Shaylin?
Yes, I do. She
Okay.
definitely had a growth spurt.
Yeah. This is, I mean, it's the most common thing, right? And so this is, I say this because a lot of pediatricians, and I don't know why they're still saying this is not new at all, but a lot of pediatricians will say, rest, deal with the pain, and there's really nothing you can do. She'll grow out of it. That's the most common thing that's said. She'll grow out of it. And what I've experienced is that's not the case. She'll grow into more movement decompensations, more problems that, yes, the pain may start to go away. I've even had athletes that they're like in their teens and like, I've got severs, my knee still hurts, or not severs, I've got severs, my ankle still hurts, or I've got osgood, my knee still hurts, I can't kneel. And I'm like, that's done. Like everything heals in the body and nothing lasts really longer than about 8 months. So reabsorption of a disc in the spine takes 6 to 8 months. And that can be painful during most of that process. But otherwise, it doesn't. So like cartilage, if we're talking about true cartilage healing, which is what a growth plate's made out of, the true healing process of a cartilage, that should take anywhere from 8 to 12 weeks. Now, someone who's had severs and oscars will say, oh no, and this is also in that handout, the doctor said to rest, I'll go home, I'll rest, and it's better. Everything's great for like 2 weeks. And then they come back in the gym, and sure enough, as soon as they hit a certain level of intensity of their impact or running or activity or amount of hours, it comes back. And the thing that people are missing is that it's a muscle imbalance. It's an improper biomechanics of squatting and landing. So what needs to be addressed is the squatting and landing mechanics. And this goes for everything, like back pain with bridges. You shouldn't have back pain with bridges. You have a mechanical something happening that's like causing you to have back pain with bridges, right? And then if you do that over time, you can gradually create hypermobility, stress reactions, stress factors, spondylolisthesis, slippage, etc. That can be the continuum of it, right? But it's not all of those structural things. It's the actual movement of inability to do everything throughout the entire arc of movement. And instead, you're doing everything in one place. So that being said, I am not an advocate for heel cups because if you watch someone squat with a heel cup on, their foot rolls in more because the heel cup makes it more imbalanced and unsteady to be on. So a lot of people love to give cheetah cups, Tooley's cheetah cups. They're a heel cup inside a little thing. There's other little sleeves that have gel in them and stuff. All of those softer surfaces create more instability. So I am not an advocate for them. Some athletes will like them because they say they can do a few more repetitions because they feel like the cushion absorbs it. To me, pain is information. So if you're using something to absorb more of your force, then that tells me you don't have the eccentric gastroc control and soleus control, the muscles in your calf. You don't have the eccentric control to stop your heel from slamming into the ground when you're jumping or landing on a tumbling pass or when you're running, right? And it also tells me you may run flat-footed. So one of the number one causes of severs, and it also can cause osgood as well, is running flat-footed or heel striking first on a tumbling pass. And that is a sign of poor eccentric control. And you might say it's just gastroc soleus. That's a piece of it. But there's also a bunch of this glute max, glute med, deep hip external rotators lacking control as well. And so when those are lacking control, you go slamming down. And now I've irritated my growth plate because I'm getting a bunch of impact there. And when I'm slamming down, I'm probably not slamming down evenly. I'm probably doing this collapsing thing. So that being said, I'm more of an advocate. Like usually I'll use the X brace. And with severs, most of my severs athletes like the X brace plus, which, let me see. Yeah, you can get them on Amazon, but the X brace looks like this, and the X brace plus has an added strap. And what this does is it gives a little more feedback to the foot so that you're not collapsing all the time. So I'll use these to help kind of calm down the inflammatory response that's happening, and at the same time be working on eccentric weighted heel raises below zero, so off the ledge of something,
Uh-huh.
straight leg and bent knee heel raises. And then I would also work on their glutes and their squatting mechanics and their jumping mechanics, because that's usually the cause of the cause. And I'll look at, like, are they tight in their hamstrings? Is there a little bit of like mobility that needs to happen? And it's not that they need to stretch their hamstrings. It's more of a dynamic mobility thing. It's usually, believe it or not, adverse neural tension. The muscles catch up a little faster than the nerves do. So part of it is needing to do some dynamic mobility work. Does
Okay.
that help at all?
Yes, yeah, it makes total sense. It
If you
also,
if you catch it early enough and it's just kind of started,
Mhm.
you can work on these mobility things, because part of it's an ankle mobility issue, part of it's a hamstring mobility thing, part of it is control and working on the squat and jump mechanics stuff, that foot control so it's not collapsing. Um, if you work on that early enough, you actually can get them out of pain fairly quickly. And you do have to kind of modify workout a little bit for a while. I'll decrease their impacts in places, but you'll be surprised. Depending on the athlete, I don't always put them, and Michael's going to kind of be surprised. I don't always put them on a tumble track, because the tumble track has a large dish that happens when they hit. And
Mhm.
if I have an athlete like Lydia, right, where I know that they need added proprioceptive feedback, she does better with a lot of information going to her brain.
Yeah.
I wouldn't put her on those lower impact surfaces. I would just decrease her numbers on harder surfaces so her brain's getting the right information. And I'd spend a lot of time teaching her what she's looking for on controlling her foot and
Okay.
controlling her hip. Does that make sense?
Yeah, it does. Would
Now,
this
with some
be?
athletes, I would. So I do have other athletes who are kind of more wired tighter, or wired, how do I say it? Like a different kind of body type where they're wired a little bit more, right? And those guys might do okay on a mix of impact, where I would put them on the tumble track and on the hard surfaces, but I'd always be doing a little bit of basics and at least some punching and whatever we can without pain, right? With
Mhm.
just a level of discomfort or less, right? Because we want to make sure we're loading the tendon while you're on your off as best we can, right? With either weights and a little bit of punching, dependent on pain though. So it's guided by that. But if you get them out of pain pretty quickly, which you can, if you fix the mechanics and work on the eccentric control.
Gotcha. Do you question that goes with this?
Mhm.
Would you say that a sign of this coming would have been her not being able to go all the way up in releve or not?
Yes.
Okay.
Yeah, that's great. So I'm glad you said that, because a lot of coaches wouldn't have noticed that. But yeah, an inability. And see, the other thing, Lydia kind of processes pain differently. We have a whole slew of athletes that process things differently now. And so it's important to recognize as a parent and as a coach when they're not going all the way up. And that's kind of a detail, right? Like, it's like, how can I do that with 20 athletes if I'm a coach? And it is a little challenging. But if you notice that with an athlete, I would go, hey, can you go all the way up? And then she might go, like, no, I can't. It's like, okay, well, what if you put weight on your hands onto like the beam or a mat? Can you go all the way up? And then if you let go of your hands, can you hold it there, or does it drop? And so if it's already starting to drop,
Uh-huh.
when she, like, maybe she can use help to get there. Maybe she can't. She still can't get there. But if she can go all the way up and then you go to let go and she drops, that, or not drop, she may not drop like that. She may just drop like a little bit instead of all the way down, right? Um, that's a sign that there's some things not working. Like
Okay.
things aren't functioning very well. And that would be my first sign to, like, how's your ankle flexibility, right? Do we need to do some mobility of your ankle? That would also be a sign of, like, well, if you're dropping, we probably need to work some eccentric training of your gastrocs. And that's where I would have started, like, early on, maybe. I also
Mhm.
would have done the squat test I just showed you. Any athlete, so like when I do performance tune-ups, what you can ask almost any athlete that comes in, the first thing I ask them to do is squat. Two-legged squat, one-legged squat. And I want to see hip, knee, ankle in alignment with a nice good arch. And that will tell you so much about your athletes, like instantly. Like if they're struggling with that, then that actual movement pattern needs to be looked at first. And you need to address it because they'll have that movement pattern way before they have pain. I was talking to a gym. They want me to come in and do a clinic coming up soon. And he was like, I feel like what's our biggest bang for our buck and blah, blah, blah. And I said, biggest bang for your buck is jumping and squatting landing mechanics. Most injuries happen on impact. They don't happen flying in the air mostly, unless they bail in the middle of something, like that's different. But most injuries, especially your overuse injuries, happen with impact with the equipment, right? So that would be jumping and landing and your ability to put weight through your hand and push off your hand, right? So I call that just wrist mechanics, right? Or upper body mechanics, loading, upper body loading mechanics. And so I was like, if you want me to come in and get big bang for your buck, let's do that. Let's do jumping and landing technique. And let's do how to load the upper body, like in L position up to handstands, and how to push off and how to make sure that that mechanical alignment is set up properly. You work on those two things and you're going to take care of about 70 to 80% of your injuries. I had a gym that just put in jump and landing mechanics from my Invincible Athlete program, and they like resolved a bunch of their issues. She couldn't believe it. So if you work on the mechanic side of things, you become more efficient of handling the loads and transferring the loads. Now you can't just do mechanics and not have strength, so you have to work on like the eccentric control stuff. Does that help, Shailin?
Yes, it does. Thank you.
Yeah. And I'd love to see her.
Yeah.
Like, maybe we should get something in.
Yes, I need to. We're still in school. So we
Yeah.
still have school for 2 more weeks. So it's been a little bit crazy. But yes, I do need to sit down and put us back on the calendar.
Yeah, take a look and see what we can do. Patricia, did I fully answer the when to take them in and when to not?
You did. And
Okay.
the documents are super helpful. Thank you.
Yeah, so in the documents, it talks about how to find a good provider as well. So like a lot of people don't realize about 48 of the states physical therapists have direct access. So you can find a physical therapist like me, or you can do it with me virtually or in person. But we can take a quick peek after a fall or a landing or whatever it is, or do tune-ups and help you check and make sure that there's not anything going on. And if there needs to be an x-ray, it doesn't happen all the time, but I refer people often like, nope, we're done today. You need to go get an x-ray. There's a couple clinics here that run fracture clinics, so we can get them in really quickly here. But that's a good window in. And then also it talks about how to find a good doctor in there. So like for a physical therapist, we're not all the same. That's for sure. Just like any other profession, every doctor is not the same either. But I show you in there how to look for a fellowship trained physical therapist, a board certified orthopedic specialist. Those are all things that I am. But there's also sports certified specialists. So I show you those initials and how to find. So if you can go to like the AAOMPT.org or our APTA.org, you can find a fellow near you or find someone that has those specialties. Those specialties mean that there's they should have a better diagnostic tool set in their belt to be able to help an athlete that's got a lot going on. The same thing with doctors is that you want to find a fellowship trained doctor. You don't want to just go, like often when someone comes to me, when I'm referring out, I'm not referring to their pediatrician. I'm referring them straight to a pediatric orthopedic doctor. And we actually have a whole slew of them here. And I refer to specific ones for specific injuries because some of them are fellowship trained in the upper extremity. So if it's something going on in the arm up to the wrist, I send them to a fellowship trained pediatric orthopedic. But some places don't have pediatric orthopedics. So then I just say send them to a fellowship trained whatever body part you're in. So there's fellowship trained upper extremity, which is shoulder down to hand, fellowship trained lower extremity, which is going to be hip down to ankle. Some of those fellowship trained lower extremities only do knee down to ankle. And then there's spine specialist, fellowship trained in spine. And so you want to kind of look for those fellowship trained doctors because they have way more experience. They don't just do their normal residency and their normal medical. After that, they do a fellowship in that body part, doing surgery, doing, not just surgery, but like just injury care as well. So you get a little bit you kind of spend less money because then you're not going from this doctor to that doctor to this doctor, which is not really mentally helpful for the athlete. The more doctors we see and the more, oh, I want to send you guys this one other handout. The more doctors we see and the more providers we see, the more my brain gets concerned that there's something wrong, right? And so that can be an issue. Let me see. There it is. There it is. Okay, so I also wanted to send you guys and show you this because I believe it's in 2022. I'll look at the date when I pull it up. Get the link, copy. Okay, so pull this one off your, that is, what do we do when we have an immediate injury? Because science has changed. It used to be RICE, rest, ice, compression, and elevation, right? And the British Medical Journal published, it's really small, 2020. I was going to say 2022, but it's 2020. They published this case, and what it showed, or not just a case, but a whole thing about ice and rest and rice and all of those things. It used to be rice, and then it used to be price. And anyways, they found that it's no more rice and it's no more price. So it's no more rest, ice, compression, or elevation. What they found is that we want to do peace and love. So I sent this handout for you. This is really great to send to your gyms because when someone has a soft tissue injury, I just went and rolled my ankle, right? I just landed and had an issue. What we found is that you want to do peace. So a very quick acute injury. This is not for your chronic injuries. Well, I say it's not for your chronic injuries. It's not, you could, if things have been going on for a while and you haven't taken it and it's really inflamed, you might need a period of protection. Yeah, great. Thanks, Patricia. I'm glad you'll share. And so you might need this for a gradual onset chronic injury, right? But this is meant for acute injuries where something just happened. So we have a period of protection that needs to happen for the first 1 to 3 days, only 1 to 3 days, unless it's fractured. Then we have other issues, right? And I will tell you guys for fractures that commonly they don't show up on x-ray for the first 2 weeks. So if I have someone who's having pain on a bone or in a growth plate and their range of motion is quite limited in a lot of directions, maybe all directions, but maybe often. But those are pieces that show you a sign like it's a red flag. They also are going to be, when I poke them on a bone, they kind of want to punch me. And some athletes, though, that don't process pain well, I've had an athlete that doesn't process pain well, and he's tumbled on fractures multiple times in his lifetime for multiple months before realizing it was fractured. So that is part of his pain processing sensory integration struggle, right? So because we know that athlete, we do tend to x-ray him a little more often when he has issues. But often for him, the fracture doesn't show up the first time. And so if they're still having a lot of pain, their range of motion is not getting better, or movement makes it worse, they likely have a fracture that hasn't shown up on the x-ray, but it'll show up about 2 weeks later. So just talking about that, that is where you do lots of protection because you have to immobilize it. But for an acute injury, something just happened, just rolled my ankle, I just sprained my knee, you want to protect it for 1 to 3 days only. You want to elevate the injury with the limb higher than your heart so that the swelling and inflammation comes down to the heart and the heart can kind of take care of it. You want to avoid, this is the part that's controversial to people. You have to realize that inflammation has a reason. Inflammation has a purpose. So you want to avoid taking anti-inflammatory medications as they reduce tissue healing. Here's the other thing that's controversial to people because it's counter to what people are aware of or used to, is you want to avoid icing because we want the inflammation. Now, I might ice, ice still has a reason. I might ice immediately after an injury to kind of slow down the nerve conduction to the brain so I can get the athlete to calm down and just get centered. But it's not that I need to ice every day for the next week or that I need to ice, in the morning, in the afternoon, during practice. It's like ice used to be a thing where it's like, do the hot and cold bath, hot and cold, hot and cold, hot and cold, alternating for the next 48 to 72 hours. the research shows that that's not helpful because it decreases the normal inflammation that needs to happen. You do want to use compression. You can use an elastic bandage or kinesio tape to help reduce the swelling. We have a specific kinesio tape job where I call it like the spider tape, because we have all these fingerlets and we basically take the tape and go fingerlets up towards the heart. We wrap around the swelling and go up towards the heart. And it usually takes anywhere from 2 to 4 strips of kinesio tape, stripping up like fingers. Education. So we want to spend some time. This is really important that they put this in here because this is their understanding about pain neuroscience. So we want to educate the athlete. It's really important to spend time on this because we have found that athletes who have lingering pain or ongoing pain that lasts longer than the tissue should take to heal and have poor outcomes, it is highly surrounded around their belief structure that they're not going to get better, or that the problem that they have is greater than something, or they have catastrophic thinking. So their thinking makes a huge change, and your thinking and any experiences that they've seen around them that were successes or failures will indicate their outcomes. So we want to educate right from the get-go and say your body knows best, and just kind of talk to them like pain is information. Right now, the pain is telling us that you fell and that things are a little irritated, inflamed. It's gonna get better. It'll heal over time. And we want to, during this time, after we're educating them, that their brain is giving them information, and that if we do know the tissue problem, like, oh, don't worry, it's going to get progressively better as we do these things. I kind of tell them what to expect. So like I've had athletes who've needed some major imaging and they're kind of in shock. I will spend time to educate them, say, yes, it hurts right now. Your body's letting us know that something's going on in there. They are going to go take some pictures of your body so that we know what's going on. It's not going to be a big deal. It's going to be really easy. It's totally normal. Everything's going to get better. I don't tell them that. Now, this is kind of, I use this of all different ages that I talk to. Like I had a really young, I was at a birthday party and a kid significantly had a concussion and needed to go. And so I kind of let her know, like, oh, this is what's coming. Everything's going to be great. And what I'm doing is I'm helping calm down her brain so that her outcomes will be better later. Whatever path she has to go, if we can calm down the brain and let them know what's coming and let them know not in a scary way. So I regulate what I say to them. I may not say everything, right? But I say enough that they understand what's coming and that they know it's going to be normal and it's safe and it's okay. And then we want to avoid unnecessary passive treatments and medical investigations. So we only want to get x-rays if we need to get x-rays. We only want to do imaging, MRI, CT scans if we need them. We want to avoid unnecessary passive treatments. So it's been shown in the outcomes and all these research that if you do a lot of passive treatments, like massage or ultrasound. What ultrasound doesn't have a lot of efficacy, by the way, on the research, but a lot of red light laser does have some good stuff on it, and it does work for a lot of things. But if that's our main source, I'm like, okay, let me just do this passive thing where you don't have to do any work. Their outcomes are not going to be as good. They're not going to heal as well. So it's okay if, like, let's say red laser is part of their treatment, but they also have movement and exercise and some mind tools and other things. They're involved in their treatment. If they're involved in their treatment, their outcomes are going to be better. And then we let them know that, like, we're going to let your body do its natural thing. We tell them, give them confidence and education that your body knows how to heal. Your body's going to know best. And we're going to also give them some autonomy by saying, I want you to listen to your body. Pain is our guide. It's information. We don't expect it to be gone because you just hurt yourself. If I stepped on a rusty nail, wouldn't I want to know that I stepped on it? Yeah. Why would I want to know? Because I probably need a doctor to take it out. I need a tetanus shot. I might need to learn to, like, not be barefoot on a construction site, or after I had my roof done in my yard, I should know that there's going to be some nails. And so how would I know that I stepped on a rusty nail? Well, I would have pain. So pain is helpful information so that after I've stepped on a rusty nail, I don't go run a marathon today. Or maybe I broke my foot. I don't need to go run a marathon right now, right? So pain is telling me how much I should or shouldn't do. So we give them this information so that by giving this information, their outcomes will be much greater, and they are playing a role in their healing. Now, after a few days, your body's going to need some love. So after a few days of peace, your body needs love. And so you want to load, have optimism, vascularization, and exercise. So load means let pain be your guide, but you want to do gradual, graded return to normal activities, which is why most often now you will see that most athletes are put on weight bearing as tolerated, which means we put as much weight as we can without a whole lot of pain. And we might expect there's a little discomfort, but it should get better as we go, not worse, right? If it's getting worse, there might be something else going on that's got missed. Or they're catastrophically thinking, and that will definitely affect it. So we're going to let pain be our guide, return slowly to our normal activities. The body will tell you when it's safe to increase the load, right? In general, my rule of thumb is you gradually increase numbers, repetitions, and impact by about 10%. That's my rule of thumb. Every 2 workouts, 10%, as long as you're successful. So if I have an athlete that's coming back from a pretty significant injury, we'll kind of decide where they are. But by the time we're coming back into the gym and we're progressing, like we might have done a period where they're not doing anything on that body part. So it's their ankle, their foot. Okay, we're doing a lot of swinging on bars. We're doing conditioning that involves anything except for jumping and impact on our foot. We're doing stretching, but we're not doing impact on the foot, right? Once we've got past that point, I'd start usually around 50 to 60% of their normal repetitions. And depending on the impact, so like I said earlier with Lydia, I wouldn't take her off of, I would put her maybe on a rod floor versus a hard floor, if that's possible. If not, I just put her on the hard floor and I decrease her numbers to like 50% numbers. I would ask her though, how many can you do before you have pain? Right? So that helps guide me where to start. And then from there, I increase 10% every 2 workouts. So they have to do 2 workouts at the same level before I increase 10% more, 10% more repetitions, 10% more like level of impact, right? And I usually, if it's an impact issue with the injury, I don't progress floor and vault on the same day. I do floor, 2 workouts. Now let's progress vaults, 2 workouts. Now we can increase floor. And we just kind of go like that. If they're at a place where they're doing really well, I might do floor one day and vault the next. But again, I'm not going to increase numbers until they've done 2 of those events successfully without any symptoms. Optimism. So here we want to condition their brain for optimal recovery. The outcomes, the best outcomes you're going to get is to condition them to be confident and positive. You're going to heal. You are healing. You're doing a great job. Everything's exactly how it needs to be. Let's keep working, right? So we really want to spend time with their brain. It's a great opportunity. And that's what the British Medical Journal, there's a bunch of stuff called therapeutic neuroscience education, pain neuroscience education, bunch of science behind how we talk about injuries and pain. And we need to really change what we say to people. Like this thing that this is torn and broken and it's a big problem. And like it makes the brain catastrophically think and it decreases your outcomes. So if you spend time saying, yep, this happens, super common in gymnastics, you're going to be okay. It's going to take 4 to 6 weeks for that ankle sprain to be fully good, but you'll be back in the gym doing some things gradually each time. And you might even be back to full gymnastics, at like 4 to 5 weeks. Like, it just depends, right? So vascularization, we want to choose pain-free cardiovascular activities. So it's really important that even like right after a few days, at 3 days or so after an injury, that they are doing some kind of cardiovascular activity. It can be arm bike, it can be biking, it can be elliptical. It just depends on like maybe it's their arm, you do jumping jacks. Like it could be anything that's not affecting the limb as far as the pain. So whatever the pain will allow you to do. But you want to increase blood flow to the entire system, the whole body, to help with repairing the tissues. And then exercise. We want to restore mobility, strengthen, and do proprioception by adopting an active approach to recovery. So I call it active recovery, right? We do a modified active recovery. So we're doing exercise even though we're injured and we're getting stronger and healthier the whole way. Another piece to this is rest, because sleep is really important. Whatever we learn when we do things, we have to rest so that our brain and body can recover and repair. So making sure that they're sleeping. And then the undersurface of that also needs to happen, need to talk about with gymnasts and can't not talk about, is fueling. You have to make sure that your athlete who's injured is eating. and eating not just enough to sustain their body, but eating enough to do whatever activities they're doing and heal, plus grow if they're in the middle of a growth period. So a lot of times, depending on the athlete and their mindset around food, they might have a thought that because they're injured and not training full workouts, that they should eat less. That is absolutely so far from the truth, because they actually have higher caloric energy needs because of the injury itself. So making sure you have a conversation with them about sleep and food. It's another part of that brain education side, because they really need to keep eating. So I know that was a little added, whatever, but I hope you guys, was that helpful? Did anyone kind of learn something about peace and love that they didn't expect? That was a little new. Shalyn or Carla or Brienne, did y'all know that stuff before? Or were y'all still kind of going with the rest and ice? Yeah, the love part is new.
I didn't know any of it. And like I said, we just went to orthopedic urgent care on Tuesday night. And they told us I sit 3 times a day, 20 minutes on, ibuprofen, no gym class, and no gymnastics for a week. So it definitely is much different.
I know. And the thing is that that's used to be the standard.
Yeah.
And a lot of people are just behind on the times. And I think that there's lawsuit happy world. I don't know if they're just afraid to change, or they haven't seen the results, or they don't know this.
Mhm.
But it happens all over the country where people are still treating with that whole um, price or rice kind of setup. And they're pushing anti-inflammatories. And I caution people, I mean, when you need medicine, you need medicine. I'm not a doctor. I'm not here to prescribe. I say that from the very beginning. And at some point, inflammation does need to be controlled, but you can control it. That's what you're seeing, is you can control it with movement and graded progression back, because you're pumping the inflammation out of the body and letting the body do its natural thing. Now, there are times like post-op and some other really major injuries that sometimes inflammation becomes really huge, and we do need to do something with inflammation. And I let doctors prescribe, et cetera, but there are also some natural ways to handle inflammation. So there's curcumin with black pepper when it's mixed together. There's one of the companies I like to use is Pure. They have curcumin absorb is what it's called. So you have to mix curcumin with black pepper in order to get the absorption, but it's a natural anti-inflammatory that can be used. Bromelain also is a natural anti-inflammatory, but it's found in pineapple. But the amount of bromelain you need for an anti-inflammatory dosage, you would have blisters all over your mouth trying to eat that much pineapple. But the point being is that you can increase your anti-inflammatory foods. So your superfoods like that help deal with free radicals, like blueberries and all your berries and your colors, your pineapple, even mangoes, like all of those have anti-inflammatory properties. Tomatoes have anti-inflammatory properties. Your leafy greens have anti-inflammatory properties. So you can increase those in the diet to help support the body, right? And there's no adverse effects to, improving your diet while trying to deal with inflammation. Avoiding sugars, avoiding caffeine. Now, I never tell an athlete, well, first of all, I don't tell athletes to ever have caffeine. Like young kids should never have caffeine. It's so not good for their adrenal system and the endocrine system. But adults taking away caffeine and alcohol is those are inflammatory, right? So with a young athlete, I have a hard time like saying, hey, don't eat something. But if they're in an inflammatory process, I might say, if you can eat less of things that are sugary, that would be good, and less Cokes or sodas, right? And then instead have more of these things. And I focus more on the have more, just because with our athletes, we're in a population where avoiding or taking away things can, one, create binging later or create unhealthy mental and emotional relationships with food. And I don't want to do that. So I really focus more on like eating more like, so fish and omegas, so avocados, olives, flaxseed, chia seed, cold water fish, like the colder the fish, the more fattier it is. that good omegas is an anti-inflammatory, is helpful with that. So there's some things you can do nutritionally and supplement-wise with the curcumin and pepper that you can help with inflammation when inflammation gets out of hand. But early on, inflammation is normal and good. And it's just telling you something. It's helping you. And so moving, motion is lotion, things as tolerated. And then always looking at like, what's the cause? Usually it's how they're moving, it's not what they're doing. It's usually how they're doing something. And so that is the number one cause of most overuse injuries. And growth plate issues are most commonly overuse injuries, unless they have an incident where they like slam down on something. Then they can get a growth plate injury that's like an acute issue and not related to prior biomechanic issues. So, but most of the Severs and Osgoods come over a period of time with very little remembrance of what could have caused it. So hopefully that helps. I'm glad you guys enjoyed today. Super cool. Next week, we have Coach Levi. He specializes in dealing with fear with tumbling. So he is going to come in. He's a coach. He's been coaching for about 15 years, and he coaches just tumbling. So he is going to come in, and we're going to talk about fear with tumbling. So I hope you guys can join us next week. It's going to be a lot of fun. And thank you guys so much for joining. Hopefully you guys learned something. And don't forget to pick up before I close everything off. In the chat, we dropped in the 3 different handouts, the Peace and Love, the Parent Pain handout, and how to care for a growing athlete. And feel free, if you're a gym owner or coach, to use these in your handouts for your team, or to use them as part of your manual. Totally give you permission to that. No big deal. So, all right, you guys, thanks for joining me. And I'll see you guys next week. Thanks, Shaylin. Thanks, Carla. Thanks, Brianne. Have a great week.